The other thing that we've also done here is put in a full vitamin line. I've been doing that for several years, but only more aggressively recently, because there are so many vitamin products out there that people are using. Nobody really knows what they're supposed to be taking, how much they're supposed to be taking. I have found tremendous amounts of vitamin D and vitamin B12 deficiency amongst many others. And by doing some of this blood testing, as well as just discussing things with the patient, we can determine what they really need to be on, and have been very successful in converting patients from the over-the-counter products to the more potent advanced products we have here, and they feel better.
Patients who will have a decreased calorie intake need to know that they might feel a little differently. They need to really be taking these prior to this and every single day, no matter if they're on a weight loss program or not, because we carry only pharmaceutically graded supplements. They're very, very nutritionally sound. They're very good for patients. I suggest that they do these every single day, and I go over the list with them. Some people have need for more iron, some people are allergic to iodine. I have a variety they can choose from.
It is very scary to know that when a lot of the over-the-counter products, 80% of them that are not tested, were actually tested, the majority of them had substantially lower values of what they were proclaiming they had in their vitamins. In fact, some of them actually had higher values, which was toxic levels, and people became ill from them. So it is of utmost concern to us that patients are not getting what they're supposed to be getting. There are vast differences also between the cheap synthetic over-the-counter vitamins and the more expensive, yet much more effective natural vitamins. The over-the-counter vitamins use synthetic products because they're cheaper. They do not have any coenzymes, they have no cofactors in order to make sure that these vitamins are adequately absorbed. The nutraceutical vitamins that are GMP certified all use coenzymes and products that will make their products absorbable. They are definitely natural and very highly absorbed, in the order of 90%. And they get absorbed within 5 to 10 to half an hour within taking them. The other myth that's out there is everybody today, because they take a lot of medicines, wants to take just one pill. And the manufacturers have seized that moment. They love to boast about the one-a-day new smaller vitamin. The one-a-day vitamin is a myth. For the most part, you cannot put all the nutrients and all the vitamins and minerals that you need in one solitary pill. In order to do so, you're going to have several pills, and sometimes they're a little bit larger. But for the most part, the industry has come up with ways to make the pills not so big, but you're going to have to swallow more than one pill if you want to get absolutely everything that's in it. Anyone that tells you that a one-a-day pill is adequate is wrong. The RDA values, the recommended daily allowances that are put on the back of these bottles, which make it look like there is so much ingredient in these pills, basically were put into effect to give you the bare minimum of what you need to prevent disease. These are values that were created to prevent scurvy and rickets. These were not values that were created in order to keep you healthy. You are getting the bare minimum in these over-the-counter vitamins.